And we are back live, and our apologies for any technical issues, but I was going to turn it over, and I did, to Dr. Neal Barnard. Please start us off in the conversation on diabetes and heart disease.
Oh, thank you so much. I appreciate the opportunity to be with you today. Diabetes is a huge issue. 37 million Americans have it now. Many more are on the way to it, and a lot of them are not yet aware of it. However, we have tremendously good news based on research that our team and that other teams have been doing, and I'd like to share that with you. My own introduction to diabetes came as a child growing up in Fargo, North Dakota. My dad grew up in the cattle business, but he didn't like raising cattle. And he left that and went to medical school, and he became the diabetes expert for that all of eastern North Dakota and western Minnesota. And he'd get home from the clinic around 6 or 6:30, and he'd set down his bag and slump into a chair. And I never once heard my father say that anyone with diabetes ever got better. And that is because they didn't understand the cause. And they thought, well, you've got too much sugar in the blood. Don't eat sugar. Don't eat carbohydrate too much that turns to sugar. But that really wasn't the issue. And fast forward a few decades. In 2003, the National Institutes of Health gave my research team a chance to test different diets and a different approach. And let me share with you what causes type 2 diabetes. It's not sugar, and it's not bread, and it's not rice. Here's what happens. Muscle cells, the muscle cells of your body, are powered by sugar. Glucose. The glucose in your bloodstream goes into the muscle cell and powers it, just like gasoline powers your car, or electricity powers your car. Glucose powers your muscle cells. And that glucose, in order to get inside the cell, needs insulin. Insulin comes from your pancreas, which is behind your belly button, and it goes to the surface of every muscle cell. And just like a key, it opens up the surface of that cell to let the glucose come into the cell. And then the cell has power. So what could go wrong? What goes wrong is that if we're eating fatty foods, meat, cheese, or fried foods, fat gets into the cell. Microscopic particles of fat get inside our muscle cells, and that stops insulin from working, just in the same way as if somebody put chewing gum in your front door lock, your key wouldn't open your door anymore. If your cells are filled with fat, insulin can't work. That's called insulin resistance. And this happens very rapidly. It's happening in children in school. They're 14, 15, 16 years of age. They're eating chicken nuggets and cheese pizza. And the fat from these foods gets into their muscle cells and makes their insulin not work so well anymore. And we're seeing kids diagnosed with diabetes before they get their high school diplomas. That's the bad news. The good news is, what if I try to get the fat out of my cells? What if there is no animal fat in my diet because I'm not eating animal products anymore? Good. What if I keep oils low because I'm not eating a lot of fried foods and oily foods? At that point, the fat that's built up inside the cells starts to dissipate because there's no more fat coming in. When we avoid fatty foods, the fat dissipates from the cell, your insulin starts working again. I'm talking about your natural insulin in your body, starts working again. The insulin resistance is replaced by insulin sensitivity. Your blood sugar comes down. If you have diabetes now, you put this to the test by following a diet with no animal products at all. That eliminates all the animal fat and keeping oils very, very low. And what you'll tend to see is that your blood sugar starts coming down very quickly. Work with your doctor as you do this, because your doctor will want to bring you down on your medicines as you get better. The last thing I just want to mention really quickly is, how do we introduce this to a patient? Or how would you introduce it in your own life, maybe to yourself or to your whole family? 2 steps. The first step is to decide, okay, I want to do this, but I want to experiment with foods. What are plant-based foods that I might like to have? Okay, for breakfast, maybe some oatmeal or cornflakes with soy milk or almond milk, or some veggie sausage instead of the meat sausage, pancakes without the butter. Okay, you get the idea. Plant-based foods, test them out. And for lunch, maybe pizza without the cheese, or the bean burrito, or something like that. For dinner, it could be pasta, not with ground beef sauce, but with tomato sauce, or a bean chili instead of a meat chili, or sushi made from cucumbers rather than fish. Whatever the case is, you're trying always the plant-based options. Test them out for a week. You'll find things you like. And then step 2, now that you've found the foods that you like, give it give it a good test for about 3 weeks. A 3-week test drive is all it takes to see the power of a plant-based diet for type 2 diabetes. When you do that, it takes the heat off your whole body. Your skin starts feeling so much better, and in the process, it protects your heart. So there you have it. That's in a nutshell, how we handle diabetes.
Amazing. Judy?
So are you saying then that if you have something that's called pre-diabetes, which is an A1C that's lower than the level where diabetes is determined to exist, that by eating a plant-based diet that you can stop that from progressing to type 2 diabetes?
Yes, a number of years ago, the Diabetes Prevention Program tested whether metformin, the commonly used drug for diabetes, could reduce the transition from prediabetes to diabetes. It does. But they also wanted to see if a diet change could do the same. And it does, even more powerfully than the metformin. So if a person does not yet have diabetes or prediabetes, now is a time to follow the same kind of diet that I just described, and the odds of you ever developing diabetes will plummet.
Can you just distinguish type 1 diabetes from the prediabetes and the type 2 diabetes that we were discussing?
Sure. Type 1 diabetes means that the cells in the pancreas that produce insulin are no longer there. They've been killed off, and they've been killed off by an autoimmune process typically. Something has happened in the body that causes your immune system, which is supposed to knock out viruses and knock out bacteria, it's now knocking out your own cells, the cells that produce insulin. We believe that this may be caused even by foods, dairy products, for example. The dairy protein can be recognized as a foreign protein. Your body makes antibodies to it. Those antibodies then turn around and start attacking you. So there's ongoing research in this area, but we now believe that kids who are not exposed to dairy products at all are going to have a reduction in their risk of ever developing diabetes. Type 2 diabetes means that you still have the cells that make insulin. They're still in your pancreas, but your body resists insulin's action. That's the fat buildup in the cells that I was describing.
So can eating a plant-based diet, if you are one of those who has type 1 diabetes, can eating a plant-based diet help at all?
Yes, it will help. It will not restore those cells. If those cells are gone, they are gone. But if you have type 1 diabetes, you're injecting insulin. And the amount that you inject is affected by how much fat is building up in your cells. So just like a person with type 2, you may have fat building up in your muscle cells and in your liver cells. And when we adopt a low-fat plant-based diet, you need less insulin because you're not so insulin resistant. The amount of reduction is probably about a third on average. In other words, if you're injecting a certain amount, you're still going to need insulin if you have type 1 diabetes, but the amount that you'll need will be cut by about a third. More importantly, you're on a diet that's going to protect your heart. People with diabetes don't usually die of a high blood sugar or a low blood sugar. It's a cardiovascular problem. It attacks the heart or the tiny blood vessels to the eyes or the kidneys or the extremities. So you want to baby your blood vessels. And the diet that I just described doesn't have any cholesterol in it. It doesn't have any animal fat in it. It's the diet for everybody who's got diabetes because it protects your blood vessels, including the blood vessels to your heart.
So you just spoke about the next question, actually answered it in part, but could you tell us a little bit more about the relationship between type 2 diabetes and cardiovascular disease?
Yes, as I mentioned, cardiovascular disease is the huge risk for any type of diabetes. And this chronically elevated blood sugar attacks the lining of the blood vessels to your heart, the coronary arteries, or the carotids that go up to the brain, or the tiny little blood vessels that go to your kidneys, or the small blood vessels that go to your feet. You can develop damage to all of these blood vessels, leading to a heart attack or neuropathy in your feet, retinopathy in your eyes. So the answer is to do what we can to restore insulin sensitivity. When we do that, we don't have so much high blood sugar anymore. The sugar is not attacking your bloodstream so much, but we also want to avoid the cholesterol and the saturated fat that will also attack the your blood vessels independently.
Mm-hmm.
So, doctor, can foods cause and also help reverse the diabetes?
Oh, yes, absolutely. I'm sorry to say that a lot of the foods that we grew up with are really the cause of the disease. Back, a century ago when the USDA started tracking, the average American was not really eating a huge amount of cheese. 3.9 pounds per year was all we could get through per person. Well, today it's about 37 pounds of cheese per year, plus burgers and all kinds of things. People are eating really unhealthy things, packing a lot of fat on their plate. That fat gets into your cells. It causes insulin not to work anymore. But we can turn that around by wiping those things off our plate tonight and adopting a healthy, totally plant-based diet. The key is to just find the foods that work for you. They're always there, and then you share this information with your family.
Which foods would be typically the really good ones in order to get rid of diabetes?
The four food groups that we're going to focus on the most are fruits, vegetables, whole grains, and the bean group, or the legume group. That's beans, peas, lentils. Those four groups are really the most important. As you can imagine, they don't really have much of any fat in them. They have traces, but not very much. And so the fat will start coming out of your cells. And also, these foods have no animal fat. They don't have any cholesterol. So they are the perfect foods for protecting your blood vessels or even reversing artery blockages if you have artery blockages already.
Do the same foods also help with heart disease?
Oh, yes. Yes, absolutely. These are the foods that not only plant foods don't have cholesterol, and plant foods don't have very much of this bad fat, the saturated fat that elevates cholesterol. But let me make two exceptions here. One is coconut oil, one is palm oil. And there's a bit of a fad now to have coconut oil and things. I would avoid it completely. It's sort of the botanical version of butter. It will raise your cholesterol. That's true for coconut oil. It's true for palm oil. So you can put it in your hair or shine your shoes with it, but I wouldn't put it on your plate. So a plant-based diet is the ideal diet for a healthy heart.
So to talk a little bit more about fat, is saturated fat what causes cholesterol for your LDL to rise pretty much? Is that one of the main causes of that?
Yeah, it's the primary cause, in fact. So saturated fat is in animal products and also in the tropical oils that I mentioned. And when a person switches from beef to chicken, it doesn't help very much because even that skinless chicken breast is about 23% fat, or they'll have salmon. Well, Atlantic salmon is 40% fat. If it's Chinook salmon, it's over 50% fat, and a substantial amount of that is the saturated fat that will raise your cholesterol. Now, don't get me wrong, there are good fats in fish too, but it's not all good fat. There's plenty of bad fat there too. So on balance, fish is part of the problem, not part of the solution.
Okay, so just to zone in on the healthy fats, if there are healthy fats, I know, omega-3s, and we need those, but can you just talk a little bit about how much fat we should be eating on a daily basis and where we should get it from?
Okay, terrific question. There are only a couple of fats that the body actually needs, and they have technical names like alpha-linolenic acid and linoleic acid. This will not be on the test. But a lot of people think, well, maybe fish oil is good. Well, as I just mentioned, fish oil is a mix of good and bad fats. Your body needs only 2 or 3 or 4% of its calories to come from those good fats that I mentioned. And as a surprise, they are in plants naturally. If you take a sprig of broccoli, you don't think it would have any fat in it. Send it to a lab, and they'll say it's about 7 or 8% fat. Mostly these really good fats, virtually no saturated fat. So if you're eating vegetables, beans, fruits, you're going to get the traces of fat that you need naturally.
Just one more follow-up on the fats. For supplementation, I know that there's a controversy now about, I think is it the EPA and the algae oil that's the controversial element there? Could you just speak about that for a moment?
I'm not sure which controversy you're talking about because everything in food is controversial, I'm sorry to say. But the big controversy that came up was DHA and EPA are 2 long-chain fatty acids. They're in fish, but you can also make them from algae, and they're vegan and so forth. And there is some evidence that they might reduce the risk of Alzheimer's. That's a good thing. But research has also shown that when people supplement with fish oil, their risk of prostate cancer goes up. This is for men, obviously, but the risk of prostate cancer goes up substantially. And at first we thought this was a fluke. We thought this couldn't be because nobody ever explained it. But we now see it so consistently that we believe it. For some reason, when people are using fish oil supplementation, their risk of prostate cancer goes up. So anyway, what can you do? You can get your fatty acids from the healthiest source. Those are the vegetables, beans, and fruits that I mentioned. If you want to take an omega-3, you can get the vegan omega-3s. We don't know if they're free of that same problem or not, but if you go online on Amazon or whatever, they have DHA and EPA, totally plant-based. But you might do one other thing. You can see if you're low or not. There are companies like Omega Quant. You pay them $50 or so, they'll send you a card, and you put a drop of your blood, you prick your finger, put a drop of blood on a little circle, send the card back, and they'll tell you, are you low in EPA and DHA or not? If you're not low, then there's obviously no reason to go further.
Fiber. How important is fiber for preventing and reversing diabetes and heart disease? And how does that work?
Okay, terrific. Fiber means roughage, plant roughage, and it's in beans, and it's in vegetables and fruits and in whole grains, sort of in that order. Beans are the fiber champion, but it's not in animal products. I've been beating up on animal products here, and it's partly for all the bad stuff they have, but there's one more thing. They don't have the fiber that you need. Now, fiber does a lot of good things. Fiber helps get bad things out of your digestive tract. It's sort of a broom that sweeps you out. But it also lowers cholesterol. So when people are on diets with lots of beans in them and vegetables and fruits, that high fiber diet lowers cholesterol in addition to the fact that there's no cholesterol or animal fat in the foods that you're eating.
Does that where the portfolio diet by David Jenkins come in? Should one, if they're looking to reduce their cholesterol while they're on a plant-based diet, look to that, which is, focuses, as you know, on soy and soluble fiber and nuts and legumes?
Yeah. David Jenkins is a genius. He's in Toronto, and I've been a huge fan of his work. And he correctly said, well, soy products will reduce cholesterol a little bit, apart from the fact that they don't have any cholesterol. But they also have a specific cholesterol lowering property. And that's also true with brand like oat bran and other soluble fibers. It's also true for certain plant sterols. These are things in plants, and they're marketed as commercial products like Benecol or Take Control. And finally, you also see this with almonds and other nuts. So what Dr. Jenkins did is kind of the obvious thought, but nobody had done it. He said, let's start with the vegan diet, so there's no animal products in it. And now let's emphasize soy and oat bran and plant sterols and nuts and see what happens. And what happened was explosive. People's cholesterol levels would drop by about 30% within maybe 4 weeks. That was as powerful as a statin drug. And you just did it entirely in your own kitchen. So that's the portfolio diet. It's a combination, a portfolio of sort of the best cholesterol lowering foods.
We have a few questions from our audience right now. I'd love to get those in here too if we have a few extra minutes. One is pretty straightforward, and you were talking about fats earlier. And the question here is, should we consume flaxseed?
You can. Flax is one of many sources of alpha-linolenic acid. That's the basic omega-3 that your body will then lengthen into other forms, including the EPA and DHA. So flax is fine, but I would suggest you do one other thing. Don't eat a lot of competing fats. So if you're getting the healthy fats from flax, but you're also eating meat, which has all the bad fats in it, those bad fats are going to crowd the healthy fats out of your body. That's not so good. That can also even happen with things like fryer grease, vegetable oils that are in the French fries and onion rings and those kinds of things. So flax, fine. You don't necessarily need it, but it's fine. But avoid the competing fats also.
Fantastic. Another question came in, this one about statins, and I've never heard this before, but the question is, do some statins cause diabetes?
When statins came out, they were miracle drugs because they would lower your cholesterol, and they do. However, they're used lifelong, and the longer you're on them, the more problems that we have come to see. And so we started to discover that, yes, the statins do raise the risk of diabetes a little bit. They cause a little bit of weight gain. There has been some suggestion that in rare cases, they may even cause dementia. So we're starting to realize that although statins are overall fairly healthy and these risks are not really common, they are not zero. And so this is all the better reason for looking to diet. 90% of people on a statin drug would not need them if they weren't eating the foods that raise cholesterol in the first place. They're taking a drug to undo all of the things that they ate at dinner time.
So technically it doesn't cause them, but in a way it doesn't do any good either.
Statins do cause diabetes for some people, yes. They increase the risk of developing diabetes. That's one of the tragedies of it.
Right.
So this has led us to try to minimize their use. But don't get me wrong, for a person who's at high risk for heart disease, virtually every cardiologist in New York would say a statin on balance for you is going to be helpful. But let's always remember the cause of this. The cause of heart disease typically is the foods that we're eating. Now, that's not always the case. You can be on a perfect diet and you can still get heart disease. And there are other kinds of heart disease that don't relate to the atherosclerotic disease that we've been discussing today.
Doctor, can calcification of the arteries be reversed?
I don't think so. Calcification builds up, and I think it pretty much just stays there in the coronary arteries. Stay tuned, maybe that'll change. But what does happen is the important thing. If you have a little bit of calcification in your arteries, it will sit there and will probably do no harm for many people. But what you don't want to have is a plaque, which is like a little blister in the wall of the artery. And if that is young and unstable, it can break open. And when it breaks open, it causes a clot to form. And that's like a cork in your artery. If there's a calcification and it's old and it's just kind of embedded in a scar and it's not doing any harm, you don't need it to go away.
Another question that came in, you were talking about coconuts and coconut oil not being good. So the question is it okay to use homemade coconut milk from the fresh coconut?
If you want to use coconut milk to, pour it in your garden or something like that, anything other than drinking it or eating it, that'd be fine.
But nothing else.
Coconut oil is, go to the store, take a look at soy milk, take a look at rice milk, take a look at oat milk, and then compare coconut milk. Coconut milk, the fat, there's a lot of fat in it, and it's virtually all saturated fat. That's what you're drinking. There's a huge fad for it, which is hard to understand. It used to be that you would go into the health food store, and it was soy milk, huge amounts of soy milk, of all different flavors. For some reason, people have gotten afraid of soy due to the mistaken idea that soy might cause cancer, which it doesn't. It reduces the risk of cancer quite clearly, both for breast cancer and prostate cancer. But for some reason, that has caused the market share to go to coconut milk, which is the last thing people should be, well, not the last, but coconut milk is something that you should not be consuming.
Judy?
Can you just tell us a little bit about the relationship between type 2 diabetes and kidney disease?
Yeah, if you were to go into a dialysis ward, you would see people whose kidneys have been attacked by really two things. In many cases, it's hypertension, because a high blood pressure blows out the little nephrons, which are the filter units inside the kidneys. They cannot handle this huge pressure coming into the kidneys. But the other thing is diabetes, type 1, type 2. Both of them will cause the nephrons to be damaged as well. Mm-hmm. This very high blood sugar that's maintained all day, all night, because the sugar can't get into your cells where it belongs, that just beats up the kidneys. So to protect your kidneys, you really want to keep your blood pressure in the healthy range. You want to keep your blood sugar in a healthy range too.
Thank you.
Fantastic. We have one more, just more of a statement than a question. But from one of our listeners, they said, thank you for being here. I was wondering if you and other whole food plant-based lifestyle med doctors are doing lectures for docs and med students. And you can only imagine how much it would help.
All the time. Many doctors are taking an interest in this. It's not been a part of our medical training in the past, unfortunately, but there's renewed interest in it. And there is also a huge interest among medical students. And so here at the Physicians Committee for Responsible Medicine, that's what we do. We give live lectures to medical students. We have online continuing medical education. I want to praise our friends in Albany who who just passed unanimously in the Assembly and in the Senate a bill saying that the New York State government is going to provide information on diet, including plant-based diets, and make it available to physicians in the state. By the way, the governor has not signed that bill yet. So if anybody wants to pick up the phone and give the governor a little nudge, that would be a good idea. When doctors help patients to understand what a healthy diet is, they're giving that gift to the patient. And unlike metformin or insulin, which you don't share with the rest of your family, hopefully, knowledge about nutrition is something you will share with your family. So you can not only tackle your own diabetes or heart disease, but you can help your family to perhaps prevent that disease and stop this from affecting the next generation.
We've run a few minutes over. Judy, Ben, do you have any final questions you'd like to ask?
Well, I do, about the resources then, and what you were talking about the Physicians Committee for Responsible Medicine and what they do. I know that you have a marvelous website. So could you just tell us a little bit about the resources that our audience can look, if they want to look into, to take a deeper dive into a lot of these things that we're discussing?
Thank you for asking. There's an app on your iPhone and also on Android called the 21-Day Vegan Kickstart. It's free. It's in English and in Spanish. We devised it for our doctors to use with their patients, but you can use it. It's terrific. It's got menus and recipes and cooking videos. Again, totally free. The 21-Day Vegan Kickstart on your iPhone, on your Android. For anybody, go to our website, pcrm.org, and you'll see lots of information there. You can just do a search for whatever topic you're interested in. I might also mention for doctors in practice, Nutrition CME, as in continuing medical education. Nutrition CME, lots of resources there. We have something called the Nutrition Guide for Clinicians. You can look up varicose veins. Just go to Nutrition Guide for Clinicians, just type that in your Google search, and then you can search for whatever disease, and you'll get lots of information there. The final thing is when people come to our medical center, Barnard Medical Center here, which by the way, we do telemedicine for people in New York. When they come in here, it's a nonprofit clinic. We talk to them about diet. On the way out the door, we give them a little QR code that goes to a website called foodinstructions.org. And you can go there now, and you'll see these cute little videos that explain everything that I just went over about the cause of diabetes. It's called foodinstructions.org.
Wow, that's great. Thanks.
We're just putting that in the chat right now, and I think we've even got a few minutes over. But Dr. Barnard, on behalf of Ben, Judy, all the technical gods who weren't with us earlier in the event, thank you so much for your time, your patience, and your wisdom today. We really, really appreciate it.
It's been great talking with you today. Thank you.
So next week, or I should say next month on Heart to Healthy Heart, we will have Dr. Nathan Bryan to our live stream. It'll be Wednesday the 26th, and he'll be discussing the impact of nitric oxide on the cardiovascular system. If you want to watch any of our episodes again, please go to our YouTube channel or our Facebook page where we have them all the time. On behalf of Judy and Ben, I'm Jim Spellos, wishing you optimal health and hope to see you next time on Heart to Healthy Heart.